This podcast is brought to you by Innovid and their Harmony initiative. Innovid believes that TV should be open for everyone and controlled by no one. And the time to make that vision a reality is now. That's why Innovid created Harmony, an industry-wide initiative to address the biggest challenges facing CTV advertising today. By optimizing at the infrastructure level, Harmony aims to improve efficiency, enhance transparency and control, and increase ROI, all while reducing carbon emissions and providing better viewing experiences for all. Find out more and get involved at innovid.com/harmony. Welcome to the Marketecture Podcast. I'm Ari Paparo.
And I'm Eric Franchi.
And today's special guest we have is Joshua Palau, the VP of Performance Media from Pfizer. Joshua, thank you so much for being here.
Thank you guys for having me. I'm super excited.
Yeah, we have a great show. We're going to talk about in-housing, about healthcare, about a lot of other things. We have an update on the Colossus thing, which I know everyone's thrilled with, and a lot of other news. So let's get into it. But first, quick housekeeping. So this week's vendor interview was about OpenRTB, part of our IAB Tech Lab series. And next week, we have Neil Richter talking about ads.tech. So that's kind of a fun one to talk about. And then just today, a pod featuring me was released by our friend Eric Seufert at the Mobile Dev Memo pod. So that whole discussion about the open web dying and all that negativity, we had a more in-depth discussion, and Eric's a very thoughtful guy, so we went deep on that. So I'd recommend checking out the Mobile Dev Memo podcast. Okay, so first we have to start with Josh's hair. Where'd it go? You have no hair.
Thank you. I appreciate that. And man, it's something I feel like I'm known for in the industry. So I do get lots of looks when this time of year rolls around. Eric knows this because we have history here. My wife started a charity event in our town. We live in a small town in Pennsylvania, specifically focused on finding treatments and cures for pediatric cancer. It's a foundation called St. Baldrick's. And basically what you do is you raise money to shave your head. And we also have this like community event where there's carnival games and silent auctions and all these good things. Because we have two friends, close friends of ours, who lost their sons. And so we started it 10 years ago. We just had our event actually 2 weeks ago. So it's actually coming in, even though people can't see this. It's a great event. And it's the time of year that people in the industry, I have to shout out our industry. Like I get so many donations from just people in our industry that I love because it's just that moment where we're all giving back. And it's just so easy. Like I tell people, like I don't get a lot of big donations. I get a lot of just like good middle-sized donations from like hundreds of people. And it's awesome.
So where should they donate? What's the call to action here?
Oh, you know what? I'll have to give you a link. If you go to the St. Baldrick's, I didn't even know it was going to. I'll give you guys a link. But yeah, search me up on St. Baldrick's, you'll find it.
Okay. Also, we'll put it in the newsletter.
Thank you. I appreciate that.
Okay. So I have another thing to ask about you, Josh. You told me beforehand that you and Eric used to be salespeople at About.com.
Yes.
So that's a long time ago.
And I'll say this, and like Eric, don't get bashful on me here. I mean, I was the older salesperson. And I came in and Eric and Mike Cassidy were working there. And I knew these two were going to do something. And I remember like when you guys left to start Undertone, we had a conversation about us going. I at that point had 2 kids. And that's where the funny story with Eric and Mike kick in, where I was like, I don't know if I could risk this. I should have risked it, but it's fine. I'm very happy where I ended up and I'm very happy for where these guys did. But it's the story I always tell people is like, I had a small group of people come to my house when Zoe was born. And here comes like, Franchi and Cassidy rolling in with this like teddy bear from FAO Schwartz and this like ski suit. And that was her favorite teddy bear, like growing up. And it's still sitting on her shelf. Like she's cycled through some teddy bears, but like that's the one that's still there. So like Brown Bear still has a front and center position.
Well, you weren't there for the wasabi eating episode.
Yeah.
That was covered on a previous podcast for our loyal listeners. Okay, let's get to the subject at hand. So we're going to start out with healthcare because I think healthcare and programmatic are an interesting mix. And we want to hear like what's it like to be trying to promote Pfizer products, and previously you were at Bayer with the regulation and the user identity, HIPAA, and all that sort of stuff. Sounds like a crazy thing to do.
It's not fun initially, at least. And if, like just to give some history, I mean, there's 2 things you mentioned Bayer, and I was also at J&J, and I share that mainly because I was on the consumer health side there, and consumer health is much different. I mean, there's still regulations. But with consumer health, you're talking about products like Tylenol and Claritin and One-A-Day. So it's a little bit easier to use data and targeting in a way that doesn't feel like you're violating people's like trust in like, wait, I have cancer or I have eczema. I have something that I don't really want to talk too much about. Moving over to Pfizer on the pharma side, when I joined in 2019, Pfizer had basically said, we're going to stop audience targeting. we felt that the company felt it was felt it was too close to maybe violating privacy laws. And so they pulled back on it. So we were doing demo targeting for a long time. And then a whole new group came in, including our new CMO, and we went back into the audience pool. And we have the ability to actually now find consumers who are in need of our products as well as physicians. We're doing it just in a way that's a lot of steps to get there. So if we have an audience provider that we want to work with, then we have to go through a vetting process of their methodology. We have to get privacy teams involved just to get through the gauntlet of, yes, this feels okay to use. And I mean, to Pfizer's credit, I mean, we've got a lot of audience providers approved. It's just there's more steps in it than you would take in other places. But it's something I feel like is an unlock for us because it's so important. Because at the same time, like the stuff that we're promoting in terms of our products, like some of our products are obviously for everyone, but there's some that are really niche and you really need them. I mean, there's products I say that, look, I want you to find our product, but I feel bad you have to find our product because something is definitely wrong with you when you're finding some of our stuff, especially with our oncology stuff. And that's just a hard thing to have to think through. But how do you find that audience in a thoughtful way so that they can get the products? In the end, that's really what we want. We just want patients and physicians to get to the right products.
What's the approach to first party versus third party? I mean, I would think you would have a good amount of targeted first party data.
So actually, it's a mix. I mean, we have, so just going back to the consumer health experience, we had like no first party. And I say, people are surprised by that sometimes. They're like, nobody wants a relationship with their mouthwash. Like, so I don't want to give you my first party information. With pharma, and I can speak also just from a category standpoint, just having talked to lots of other folks in my space, like it's a mix. Like when it comes to physicians, there's a lot of first party data that we have because we're sharing clinical trials and information and education that they will sign up for. With patients, it's a bit of a mix. Some of our products have a good amount of products or categories have a good amount of first party, and some don't because, again, if you've received it, if you have something, I mean, something as simple as eczema. I mean, it's not something that's life threatening, but it's not something you want to promote. You just want to get in, get your information and go. So we've actually been having to focus a lot more on using first party data of a partner or looking at places where, like, again, we can get third party audiences that actually look like the ones that we need to target for other products.
So what's the world of third party data look like in health? My understanding is that a lot of the companies out there that are doing health data are sort of taking the raw health data and then just modeling it like crazy against geography and demos and stuff like that because they don't want to actually target individuals.
There's two ways that the targeting has come up. I mean, the one is the most simplistic, which is just a bunch of endemic. So, as someone who's done a ton of programmatic, a ton of targeted buying, I was like, wait, how many direct deals do we have? And I saw this list. I was like, oh my gosh, like, why is this so big? Like, why are we spending so much? I say this sort of sarcastically because yes, like if you think about someone researching something that's wrong with them or researching a condition that they might have, they're going to go to these endemic sites. So there's a one view, I think, where pharma has some level of advantage where the endemic sites are pretty good for us. And I think that's something that you don't see in other categories sometimes. On the other side of that is, yes, I mean, the audience providers across the board that we are working with, they're usually starting with some sort of seed, whether it's a claims, and I'm talking right now about patients, not HCPs, but it's usually starting with a piece of claims information, a purchase signal, a diagnosis code that they might have submitted. So it starts there. And then, yes, like to blend the audience in a way that's actually usable, but also not so identifiable, like whether it's Epsilon or Swoop or Crossix, like they have to like not water it down, but they've got to like model it enough that like, I know Ari has this, but I don't know it's Ari. But I will say like, it gets us from the data we're seeing, it gets us to the right audiences but I do think it all starts with that, at least what's the identifiable piece that says we know this person has been diagnosed or has been treating.
Right. And what's the current state of play on sensitive data and your understanding? How's that come into your work?
We got FDA guidelines that we have to adhere to, like they are the law of the land. And then Google has its own set of laws. And this is not a criticism of Google. But I remember when you talk about sensitive categories, I remember a time in which we were trying to load audiences for a laxative product. And over the counter, people get constipated, that happens. And we'd get these audiences bounced. And so I never could find a policy person because that's like finding the Easter bunny. But I found someone who finally said the way we make some of these decisions on sensitive categories is if you were in a grocery store and you asked for the price check and somebody announced it over the loudspeaker, would you be embarrassed? My thought was like, that's not that scientific.
That covers virtually everything I shop for.
Right. Yeah, exactly.
So you're saying that Google's more conservative about this than the pharma industry?
In some cases, yeah. And it's a conservatism because I look, they're always in the line of fire. So I get it. Like I do kid. I mean, and it's, I'm not, again, I'm not I'm not Heimlich on Google, but I'm in the middle of the two. And I do think, which by the way, I love Adam, and I think like 98% of his takes are spot on. But then this one, yeah, I think they err into the side of like overcorrection because they're the ones who are going to get the lawsuit when it hits.
Right. So can you remind our audience, like, what is sensitive data? What's the official rule on it?
It's basically if you can get down to like a category of one, it has to be somewhere in the world of being identifiable, but it's a lot around like disease states that again you don't necessarily want to promote or broadcast. I mean, I'm type 1 diabetic, zero problem disclosing that to anybody, along with my ADHD and anxiety. But you got a lot of people who don't. So a lot of it falls into the category of what is the disease state that's being treated. And I think that's a big component of it.
What about like measurement and attribution?
That's another fun one because I've come from worlds where, and by the way, like aside from the health stops, I've been at Comcast, I've been at Lending Tree, I've done a couple of agency jobs. So I've seen a ton of categories. And it's this category is the one that the attribution piece is more difficult in that you have to, it takes longer to get to some of the information. So Comcast, Lending Tree, you come to the website, you probably know what you want, you click, you buy, you get approved, you move on, I get that pretty quickly. At Bayer, we were using MTA. So we were getting like good 6 to 8 week reads of like the person saw this, here was the exposure, they purchased the product. The healthcare is really beholden to a few companies in the space that can actually share back where their scripts got filled based on exposure. So the big player in the space is IQVIA. And so we look at them as a partner to say, okay, so, Eric saw this ad, didn't click on it, didn't do anything, but we know that later, again, in this world of unidentified information, that he then filled the prescription for Nurtec, which is a migraine medication of ours. And so that's become the glitch, when it comes to healthcare, because when you're looking at the D2C thing, some patients, I've been suffering from migraines for years, go to my doctor, they say, try Nurtec, or I'll call it right now, CVS, and you go right in. Some still are taking their time. So the challenge, I think, for a pharma marketer when it comes to the D2C side of the house is, you're trying to figure out when to optimize and change things when you may not get results on some of your campaigns or some of your channels actually for like several months. The other thing is that the drawback also with IQVIA, and I take that back. It's not IQVIA's fault, but the search and social, they can only model off of clicks. And so it makes it harder. Now I will say, I will give Meta credit. They are doing some piloting and some testing and how do we actually tie exposure to actual script lift? And that's big. I think it's going to take them a couple of years more to come around to it. But if you want to keep getting pharma dollars, like you have to find a way to prove out that, or to show me that the investment led to somebody going on script. And because that's really the holy grail. And that's just the consumer side of it.
Which makes it interesting to look at pharma because it's such a big category of television advertising. And, the ability to measure that is quite a bit harder, to say the least, right, than digital. Why does pharma invest so much in TV? And, what do you think the sort of future of TV and pharma and healthcare is?
Yeah, so I appreciate you bringing that one up. And then for the record, everybody's listening, this was not rehearsed. So this is good because I had an answer for this and it's actually, I feel like it's a good one. So it's a couple of things. And like, again, the three of us, like we've been around for a long time. So going back to the about.com sales days, I lived in PA, so I was always the pharma person. So I had all the pharma clients. So I watched firsthand, like trying to explain to people that this internet's a thing, but all the money was going to TV. My impression on like why pharma spends that much there is it falls into a few buckets. Like one is simply like, look, it's a lot of the products are mass reach products. So just go as wide as you can. And if you hit people with enough TV, it works. And I don't know, like I think of the brands that were blockbusters, like it worked. And so I think there was always a desire to want to stick to that model because, again, like, we reached enough people and we saw that come in. I think when you start getting into more specific niche categories, TV becomes a little bit harder because, again, only a certain percentage of the population suffer from migraines or eczema or rheumatoid arthritis, much less anything in the cancer world. So I feel like the model of TV still worked, but at a little bit of a smaller scale. Now get to where we are today. And it's a great point because we at Pfizer are actually looking at the upfronts. And I know companies say this, but we are truly living into it. Like we looked at the upfronts very differently this year. We went to all of them. It was very interesting in terms of what they said, could be done. And they're speaking to a broad audience. We're thinking through first of like, what's our data first approach when it comes to the audiences that we can look at, and then looking at how we actually tie those to the display buying so that we're actually doing things in sort of a more single use for managing reach and frequency, for managing messaging. Like we're trying to say, hey, like everything has to be data and audience led to start with. And then we're going to work backwards into where else are we putting our dollars. And so it's funny because partners who weren't giant partners of ours in the past because they weren't big TV networks are becoming bigger partners because they offer that ability. We're still buying linear TV. Let me just be clear about that. That's the big piece there. And I think it's just trying to find that balancing act of like, I tell the story of like the second I turned 50, like YouTube TV started serving me shingles ads and they did not serve them to me the day before, but that's been good. Like that's what you're supposed to do. And I think Pfizer's learned that this like mass shot of TV made sense, but now we could probably think about being more efficient with our dollars and going in a more targeted group.
So I wanted to talk about in-housing. Before I do, I want to have a quick shout out to the book I read called Empire of Pain, which is about the Sacklers and Purdue Pharma and all their abuses. Now, what's interesting about that book is the first half of the book is not really about opium. It's about the history of pharma marketing because the Sackler patriarch effectively invented it in the 1960s. He was like Mad Men for pharma, and he invented the concept of pharma marketing. It's fascinating. I think he founded the company you mentioned that does all the measurement. He was the first person to ever measure pharmas. So anyway, strong shout out, Empire of Pain. All right. So I want to switch gears because in-housing of programmatic, you're an in-houser. You've been an in-houser in multiple places. You're kind of the poster boy for in-housing. So what's the current state?
He just didn't still like me, which I feel good about. Sorry, I could jump there. Would you say that?
No, I mean, what's the current state? It was a really hot topic like 5 years ago when I was trying to sell my DSP to in-housers and no one used it. But it's become less of a hot topic. It's sort of blasé. So what's going on?
Yeah, I think things worked out though. So yeah, but it's so I do talk about this often. And when Pfizer went from Cara to Publicis, this is all public information. You know, they said, and we're moving all the business over, and it's far beyond just media. It's strategy, it's planning, it's creative, it's data. So that it's a big, more integrated partnership than what we had in the past. And then like it wasn't a throwaway line, but then it was also at the end of like, oh, and we're gonna also bring services in house and build internal capabilities. And so that happens while I'm in the interview process. By the way, I knew why they were interviewing me, but I thought it was because of my healthcare background. And the media like recruiter was like, no, that's not why. And I said, well, is it because I worked at big giant companies? Like, well, not really. And I was like, well, what is it? Like, well, they're announcing they're going to in-house. I was like, oh, that's why I'm here. So I would say like in-housing is like my Hotel California. Like I got to do it everywhere I go because people just expect it.
And you can never leave, right?
No, I could never. Like, you know what? That is the best line of it. Yes, I can never leave. So we embarked on this trip of saying, okay, like it was different than what I had done at Bayer. In that with Bayer, we had 4 years of decline. We had massive turnover in the organization. We also had turnover at the leadership. So it was prime for like, what can we do? And I remember a very senior person there saying to me, like, what do you got in the bag? Like, is there anything you think we could do that could turn the ship around and help us financially? And so myself, the team, we crafted this great idea. I didn't think they would actually buy it. It was very much laid out from the get-go. It was like, we're going to do this. We're going to remove that. We're going to work with Mighty Hive, and we're going to move on. And so there was buy-in across the organization. Pfizer's approach is a little bit different in that we've said, hey, we want to do this. We want to do it in a different sort of thoughtful way because we're already moving from one agency to another. So I knew coming in, the plan was now like, hey, I'm going to show up and in 30 days, I'm taking everything away. So the approach I'm using here is sort of like a hybrid, and then eventually we'll go to all in, which is starting with just like channel strategy, meaning like Pfizer has people now in the building who have deep expertise in search and social, programmatic video to basically lead the channel strategy that we implement with Publicis. So I want to be clear, like Publicis is still lending strategy to this conversation, but we are being more heavy-handed in saying like, this is the DSP we want to test on. If we want to use a data provider, like this is the one we want to do. We want to optimize to this particular metric. It's great that you have a hold code deal with this company, but we want to use this company for measurement. Like these are just examples of where I think it's critical. And for all the marketing people that are listening, the more expertise you could have in the building, the better off you'll be as an organization. And because I think years ago, and I know Eric, you dealt with this too. Like years ago, it was like, oh, like I know digital and I work here at a brand, but you weren't like a digital person. You were just the person who managed the agency. And that's not a bad job. It's hard to when you're not the expert. Because at some point, the platform or the partner will tell you something that you just don't know if it's true or not because you're not the smartest person in the room. And so, or the deep subject matter expert, I should say. And so the idea that we're going with now is let's get those subject matter experts in. Let's get them started to think about what we're doing and how we should be approaching each channel. And then as a parallel path, we're going to pick channels as we go and start to bring them slowly in. So phase 2 is to do hands-on activation. And so we'll be bringing search in-house. The timing is still on TBD because it's predicated more on hiring than anything else. But we've got some people coming on board. And then eventually we'll start to move things from a world where we'll be managing some and Publicis will be to eventually us managing everything.
And is it for improvements in quality and results or cost savings?
It's a few things. And actually, I'm going to go with the last one first. I always say when it comes to in-housing, don't think of the money first. And I say that for two reasons. The first is if you think about the savings, you're going to make decisions that might not be the smartest decision. Meaning like you might choose a provider that's cheaper, or you might try to say, well, do we need 5 people? Like, can we make it with 2? And so put that out off to the side. The first question you have to ask yourself is like, are we a better organization if we do this? And then when you answer that question, because it's almost always yes, then the question becomes why. And so my sort of, I guess, if we're going with the Hotel California, my sort of chorus part of this is it's like it fits into 3 basic areas. The first is when you're in-house, you understand the products, you understand the brand, you're part of the same team, you have the same goals, objectives, reporting structure, bonus schedule. You're not the agency person that got thrown from one account to another and you have to get up to speed. So I think there's just that shared sort of vested, hey, we work together. And now I understand the difference between a pain sufferer and why they want an Aleve versus a Bayer aspirin. And I think that's one particular thing. The other one is just faster insights to action, which is like an overused term to a degree. But you're sitting in a meeting and you find out that, hey, like we've got some distribution issues over here at CVS, or we're finding that this audience is actually performing really, really well against scriptlet. You have somebody in the building that just goes, you know what, click, 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 we're done. As opposed to like, here's the monthly report and then we're going to do this. So there's a lot of that happens. And then the third thing I talk about also is just like the integration within the organization. So there's insights to action, which is separate from what this thing is. What this is like, I know the tagging person, like I know that the person on the IT team that has to make this work, for us. So it's more seamless integration into where you have to get stuff done. Like when you're on the agency side, you're trying to get a site tagged for your campaigns. It's hard. And it's hard because you're going to a different organization, but now we're all part of the same family.
Right. You get a much faster turnaround time on all the things you want to experiment with, all the results, everything like that. So one last question on this. Like, I feel like in the ad tech world, a lot of times we're all talking to each other in a little bit of a bubble. We obsess about things like SPO and whether DSPs are being cut out by SSPs and stuff like that. Do marketers care about the same things?
Oh my gosh, this is like, I love this question because you said this once before, I think, and I think it's a question like it's always good asking. I say yes-ish. And what I mean by that is this. I think marketers want to understand like what they're doing and how they can be better at their planning. And so somebody told me I said this at a conference. I probably did. I just didn't think I did. But apparently at some panel I was on, I said, like, if you don't understand media and data, you can't be a good marketer. That sounds very condescending, but I don't know. But it played well for the room. I remember. And so the point being is that I think marketers care. And if they don't, they need to care about how we buy your media, how we look at the supplier. So to your point on SPO, like I say supply chain optimization, or supply chain optimization, but I do talk about what that really means. And I've been fortunate in my career. And I think it's partly also because I'm somewhat of a child, but like I explain things very much in a like simplistic way. Like you do this and like, you buy this piece of media and all these different hands are in your pocket and we're trying to get rid of those. So I think they care to know what you're doing so they can understand it and realize like the complexity of it. I don't think they care whether we buy Magnite or Pubmatic. Like obviously I don't think they care about, but I think they care about what is it that you're doing that's getting the results and how do I get better at it?
So let's take a quick break. And we'll be back with news around Colossus, TrustX, AI, Apple, a bunch of other stuff. A lot of stuff to talk about. So let's dive into it. This podcast is brought to you by RainBarrel. RainBarrel is a cookieless consented audience graph that helps advertisers interact with their best fit customers. Digital advertising shouldn't be a black box, which is why RainBarrel was created by media buyers for media buyers. With over 12,000 public audiences, RainBarrel has helped renowned brands like a large golf retailer explode their campaign reach by millions just by tapping into the right audience for golf course and country club visitors. Try out RainBarrel audiences on DV360, The Trade Desk, LiveRamp, and beyond, or learn more at rbarrel.com. That's rbarrel.com. All right, we're back. Before we go to the news of the week, I want to do a Colossus update. I know everyone's totally sick of hearing about this story, but I do have an update, which is I wrote up in my newsletter this past week, and one of the things I reported on was that Colossus had been using LiveRamp, and that was something the company had told me, and I had assumed that it was part of an ID bridging solution, and LiveRamp wanted a clarification. So here's LiveRamp's clarification, not a correction, clarification, which is that they did enter into a contract with the holding company that owns Colossus. It was a flat file ID graph solution. They are no longer providing that data, and they did not have any sort of SDK or other system. They have a system I think they offer to the public that was not in use. So to the extent that there was any sort of mismatching on the IDs, that would still be in sort of the Colossus server-side technology, not provided by LiveRamp. So they wanted that clarification. So happy to do that. If anyone has any hot tips on Colossus, you know where to reach me. All right, Eric, you're on.
The Marketecture Pod is so influential. You're being asked to do clarifications. So impressive.
I've only been threatened to be sued once so far.
Once so far. Let that be once as an investor in the business. Anyway, all right, great. Lots of news this week. We'll kick it off with a startup funding announcement, which my firm and Ari personally participated in. So the company is called Symmetry, and they raised $5 million. The headline is to launch the world's first privacy firewall and real-time data clean room for the open web. Lots there. A couple of things about this are interesting. I think, Symmetry acquired TrustX, which was the, kind of premium SSP that was owned by DCN. So, they acquired an interesting piece of technology that, normally would take a long time to build. So, kind of gives them a slingshot lead in having a publisher footprint and some initial, supply side technology. And then the other thing is they did a deal with Akamai. Akamai has been this kind of quiet monster as it relates to ad tech because they've got these great capabilities, and they're working with Akamai to basically take part of their edge compute platform to build this firewall. So basically the idea is the open web needs a clean room. And what Symmetry is looking to do is take deterministic data from the supply side and the demand side, create a firewall so it's done in a privacy-centric manner, and have a new offering in the marketplace. Awesome idea. Very unique execution via both acquisition and partnership, and raised an amount to get out the door. So excited about that one. All right, do you now understand Symmetry?
Not really, but here's what I tell people, which may not be correct. Which is, in the current situation, SSPs are having a lot of IDs augmented to them on the web page, and then those IDs are flying around the internet. And in the Symmetry use case, I believe the IDs are augmented in the cloud. So you don't have IDs flying around. You still have the matching by IDs, but it's done on the edge, as Akamai likes to say, which seems like a pretty big improvement in privacy. So I'm excited about this.
Yeah, that's the sort of idea behind the privacy firewall. Another quick shout out of another company that announced funding last week was Pilot Desk, which is the new startup from the former team at SpringServe. We invested. They're building an AI workflow for ad ops, which is this idea that I've been obsessed with for so long. That's so excited to see a team in place. And Joe Hirsch is just hilarious. He had the two of us dying when we were hanging out at the DFS show. So shout out to Joe. Anyway, we'll get going on AI. So Ari, Google's AI search is garbage. Tell us about it.
Okay, this is a totally subjective opinion as a consumer, but it's garbage. It's awful. First of all, it slows down the search results. So I've had numerous cases where I've searched and then the AI stuff shows up later or interrupts the page, and then the results have been wrong most of the times I've used it. Like, not just some of the times, like significantly wrong most of the time. It just seems like an absolutely not ready for prime time product. There's numerous threads going around about how many people are trying to opt out of it. And one of those popular searches is, how do I turn off AI in Google search? It's awful.
All right, great. Next bit of AI news come from OpenAI yet again. So OpenAI did a deal with News Corp. This deal is interesting. It's yet another of these deals where OpenAI can use content from News Corp's publications, including archives, to answer queries and train its tech. This is a relatively big deal. Deal could be worth $250 million over 5 years, with compensation in cash and OpenAI tech credits, which, increasingly I think are going to be a cog for every company, media and otherwise. And I think there's a question here. I would love to get both of you guys your takes on this. Will deals like this save publishing, right? Gen AI needs publisher content. Publishers need sustainable revenue streams. I think the question is, how big can this be? And ultimately, can this be something that's meaningful? Or is it just going to be an overall threat and it's going to continue to, kind of push on the downfall of publishing? Just riff on this. Maybe Josh, you want to start?
Yeah, I'm fascinated by this whole thing because I feel like we've been in this space so long and you're like, well, it's Google will be here forever and they'll do search forever and no one's going to beat it. And now you're sort of like, wait, there's definitely some cracks here. By the way, I did want to comment real quick on the AI thing from earlier on them releasing that. It just started like Google is now just starting to feel like a mix of like Reddit and Dotdash Meredith pages. And so, and then whatever generative AI kicks in, but it's a very different experience than I think it's been for years. Related to this though, I find this so interesting because I love, Morrissey's podcast, The Rebooting. He talks a lot about publishers, and this publisher thing is interesting because like all of them have lost traffic that comes through Google. And so how do they monetize? And if they can find ways to actually take that back, not monetize, but how do they get greater distribution? And I feel like if AI can do this in a way that gives good answers, like it's a gold mine. And the question starts to become when now a publisher, because I know Dotdash also just cut a deal, like whose results are going to get better or whose results are going to show up first. Like I think that's going to be the thing that AI's got to figure out, but it's something that comes through the tool. So I just find it so fascinating because I just feel like the way in which people are going to start to interact with these tools is going to be very Google-like. And then what's in them in terms of like the content that's there, like how do you parse through that? Because if they cut deals with only specific companies, you're not going to get the full view that Google tends to give. But again, Google tends to give a bunch of Reddit results. And so it's a fragmented space right now that I always thought search was the safest for disruption in this, growing up in this thing.
Yeah. But when you get an answer on Perplexity, when you get an answer on ChatGPT, you're not going to the publisher site. Maybe they're going to change that. Maybe they're going to, have links as part of these results. And maybe this ends up being maybe the future of kind of traffic driving. But that's the issue here. They're just providing the data to give the answer. And maybe there's brand recognition. But ultimately, I don't know if this is the future of search.
I think the other thing too on this one, Eric, is it because to your point, Ari, like, grab the bag where you can. I mean, do these become like licensing deals? So it's recurring revenue. I mean, I know, $250 million. I don't know what $250 million over 5 years is not, is not the same as getting, the revenue they're getting from advertising that comes from the search engines, but it's maybe just another way to like, I don't know, pad the walls, stop the dam from bursting.
Let's talk about Apple. So two interesting things here. Eric Seufert, mentioned him earlier. He noticed that Apple is running ads on Meta for apps and app bundles that drive to their own app store. So this is interesting. And, the question is twofold on this one. I'd love you guys to riff on this as well. So A, is this Apple's version of a reach network taking demand from the App Store, search ads, and putting them off site, i.e. just get, more and more downloads via an ad network-like model? Or B, is this arbitrage against their 30% install fee? What do we think?
Yeah, and I think in the short term, publishers just grab that bag. The money's there, take it. It's very complicated. As an example, I just did a very complicated Perplexity search because I was having this weird technical issue. Gave me a perfect answer, and I then clicked through to the source material.
I do think there's some offsetting to the point on the arbitrage piece. Even with like hiring now, I know they're building out like their offering for media. Like it feels like they're starting to embrace more the like, hey, we've got to take part in some of these other platforms to keep driving our revenue and our downloads, because at some point it just gets stagnant for them.
I'm just worried if they license News Corp data, I'm going to start searching and it'll talk about the migrant caravan coming to get me and stuff like that.
I think that's an interesting question. I think, Eric's theory is interesting, but just take a step back. Apple's a $3 trillion company. I mean, this is not even a rounding error if we start looking at, is this a case of like arbitrage and everything like that? I'm with you, Ari, in that this is reach extension, because the thing that's very important to Apple is to keep developers happy. And, if they can, even with the 30% fee, just keep growing downloads and driving more and more downloads, like strategically, that's the important thing for them.
Well, I'll tell you, Eric thinks it's the latter. So Eric, in his commentary on this issue, said that the current trend for many apps is you run an ad on Facebook that links to a web page where you sign up. And then when you get the confirmation email, hey, you've successfully signed up, that's where they tell you to download the app. So that is to try to get around some of the fees, skirt the fee, right? It may be possible, but I do think it's probably more of a reach network because they have these advertisers buying search terms on their app store. Whether it's opt in or opt out, I don't know. I've never seen any reporting on this, but I would imagine if you have all that demand, you have the click through URLs, you have the payment term. If you can make an arbitrage against that, why wouldn't you?
True. Okay. Point taken. Next thing on Apple, another interesting thing is, so Semaphore reports that Apple News is starting to be a significant revenue driver for, guess who? Publishers. So it was noted that Daily Beast is making like $3 or $4 million a year. Time says one of our most important partners, Apple News is, and delivers 7 figures of revenue for Time annually. So, it's another interesting thing where it's, not going to make or break or save a publishing business, but it's strategically interesting. It probably pads the walls, to use Josh's term, and, ultimately could help them, reach more and more users. It's just this model of publishing on platforms. It just has not worked since, the beginning. And I question if Apple News is going to be some sort of panacea.
And then the real sticky wicket is, what are they using for attribution? Are they subject to SCAD network, or do they have actual attribution numbers, which would be, a very serious finger on the scale against other advertisers?
When do you use Apple News, if you use it at all?
I use it by accident when I click on the wrong link in Twitter.
Same thing too. I also wonder, back to the AI thing, I think this is also you're probably seeing an uptick here because this is where my content's there, right? It hasn't been scrubbed out of the system by AI and Google results. I think that's probably a part of it too. But I do also, never gone there, and again, unless it's by accident.
Yeah, interesting. Okay, all right. Well, one more, we'll round it. So there was an X thread that was really interesting. So Olivia Corey, who I think runs a D2C focused company, said the Trade Desk has to be the most successful company that no marketer I know is using. $46 billion market cap, nearly $500 million in revenue last quarter, and no one here talks about it. Why hasn't it caught on amongst D2C? And it was a good post with a ton of responses. And I thought a lot of them made sense, and there was no question on, why. So it's TTD focuses on the enterprise. TTD has high minimums. TTD is not focused on the performance segment. It's all pretty logical stuff. All right, no, you surfaced this one. Did you see anything that was interesting or notable or counterintuitive?
Well, the way I would look at this question is, who's right? Are we, what we consider the ad tech community, people like Josh, who do a lot of programmatic, are we the ones who are right because we know this inventory performs if you work hard enough at it? Or the DTC people who ignore the open web and spend all their money on metas and other walled gardens, are they the ones who are right, or we're dummies?
I'm sort of perplexed with this one a little bit, because I think that the folks in my space, but not my space, where I'm sitting, it seems like to me it's a no-brainer to use a partner like this because of, again, what they've got, what they can offer you in terms of the audience quality, the measurement, and the things that all come along with it. I think that the thing is, and I was at the Head Tech Economic Forum, I know you guys were there too, and what I found so interesting was that slide that Tom put up that showed the percentage of where I could find audiences regardless of cookies. And it was basically was a giant, the whole thing was taken up. And so there's just I feel like, and I don't know if I'm completely answering the question, but I think there's this interesting piece of what you use the Trade Desk for versus what you use the open web for in other places to find those audiences. And so, but I'm so stuck on, Meta and Google and the places that you go to, the walled gardens, because they've got the cat that's in there. So I don't know if I got a great read on this one. But I think the idea that no one talks about it is kind of interesting, just because, maybe it goes back to that question you guys asked me earlier. Marketers are just trying to think about how they reach their consumer.
I think the devil's advocate would say that agency-driven media spend is not as firmly focused on well-measured performance metrics, and they have pseudometrics and reach, and therefore open web continues to perform according to those metrics. And if you're hard-nosed about driving cash registers, it's much harder to justify a lot of open web spend. That's the negative point of view.
And who is TTD targeting? They're targeting the agencies. I would actually imagine that, some of these D2C marketers who work with agencies, they work with the Trade Desk. They just don't know it because the agency is using it as part of the plan.
Yeah, and the smaller ones are buying quite a bit of open web display. They're just doing it through GDN, and they don't really realize that they click the display button in Google Ads, and that effectively, that data those ads then flow through AdX to major publishers on a performance basis.
Yeah. And part of the, just to add one thing if you guys don't mind, I think part of the thing that comes out of this is it's a whole other subset around the agencies promise, understandably, because there's very little differentiation to some degree, they promise efficiency. And so there's a level of, like you said, like you were saying, Ari, I can get to some performance metrics that look good, but there's more, you didn't say it this way, but more surface level. And when you start to dig in, again, I'm going to have an issue when I come up against hey, there's a couple of audiences and a couple of providers who cost us more money, but they drive higher prescription. And I'm going to go forward with those because those are the ones that I think are going to drive the value. And I think that's where that's where marketers, to your point, need to understand what's really driving performance versus just cheap cost.
All right, I think that's a good place to call it. So this is a great episode. Josh, thank you so much. You give us incredible insight on pharma, in-housing, and a lot of other stuff. So thanks for being here.
Thank you. Appreciate it, guys.
Eric, always a pleasure.
Yes, thank you both.
Thank you for subscribing to Marketecture. New interviews are added every week at marketecture.tv and your favorite podcasting app.